HIV, viral hepatitis epidemics, and sexually transmitted infections are killing 2.5 million people every year globally. This is according to a new report by the World Health Organization. And the World Health Organization has issued a new report flagging major increase in sexually transmitted infections amidst challenges in HIV and hepatitis. And as if that is not enough, there is also an increase in multi-resistant gonorrhea. Elizabeth Atieno now unpacks the grim statistics.
Every single day, 1 million people in the world are infected with at least one type of curable sexually transmitted infections, which include syphilis, gonorrhea, chlamydia, and trichomoniasis.
As of 2023, out of 87 countries where enhanced gonorrhea antimicrobial resistance surveillance was conducted, 9 countries reported elevated levels of resistance to the last line of treatment for gonorrhea.
In 2022, 8 million adults aged between 15 to 49 are reported to have contracted syphilis globally, with 230,000 syphilis-related deaths reported in the same period.
New data shows sexually transmitted diseases are on the rise in most regions. New syphilis cases among adults aged 15 to 49 years increased by nearly 1 million in 2022.
The 1 million increase in syphilis infections derailed efforts by WHO member states, who set on an ambitious plan to reduce the annual number of adult syphilis infections by tenfold by 2030, from 7.1 million to 0.71 million. World Health Organization says there are more than 30 different bacteria, viruses, and parasites known to be transmitted through sexual contact, including vaginal, anal, and oral sex. Some STIs can also be transmitted from mother to child during pregnancy, childbirth, and breastfeeding. Additionally, the WHO report indicates that during the COVID-19 pandemic, there was a surge in adult and maternal syphilis, with 1.1 million cases reported, while associated congenital syphilis accounted for 523 cases per 100,000 live births annually.
This increase occurred in the region for the Americas and the African region.
On a positive note, new HIV infections have reduced from 1.5 million in 2020 to 1.3 million in 2022. However, 630,000 HIV-related deaths were reported in 2022. 13% of these occurring in children under the age of 15. 5 key population groups: men who have sex with men, people who inject drugs, sex workers, transgender individuals, and individuals in prisons and other closed settings, still experience significantly higher HIV prevalence rates than the general population. In 2022, around 1.2 million new hepatitis B cases and nearly 1 million new hepatitis C cases were recorded. The estimated number of deaths from viral hepatitis rose from 1.1 million in 2019 to 1.3 million in 2022, despite effective prevention, diagnosis, and treatment tools. However, not all hope is lost. Out of the 8 pathogens linked to the greatest incidence of STIs, 4 are currently curable. They are syphilis, gonorrhea, chlamydia, and trichomoniasis. The World Health Organization has called on nations to accelerate efforts to address ongoing criminalization, stigma, and discrimination within health settings, particularly against populations most affected by HIV, viral hepatitis, and STIs. Elizabeth Atieno, TV 47, Nairobi.